Hello friends, how many of you have been watching videos on how to close gap between teeth, how to pull back your front teeth and etc. videos, and you have been landed up on this professional video. You can see n number of things which are DIY, that is do it yourself videos. That is at home you can collect some appliances or hardware material which is available at home easily, and they are applied on your tooth or teeth to close the gaps. Does this do it yourself really work, or is it doing more of harm? What are the risks? What are the alternatives that we can opt for? And when is the right time that you should visit your dentist for the treatment of your teeth? Come friends, I being a professional practicing dentist today, who has been into this profession since a long time and is practicing and looking into many cases every day, want to give you a small piece of advice in this today's video. Come, with a very genuine opinion, let us begin this video. Come, let us have a look at this video.
Subscribe to my channel Dr. Mansi Shah to get dental tips and tricks.
Hello and a very happy morning to all of you. And here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, as we are today speaking about the do-it-yourself braces, is it really possible that you at your home can treat the minor gaps or some large proclination of teeth? Is it really possible? And my answer would be, please don't do such trial and experiments on your body. If your eye gets damaged or finger gets a cut, or if you're not feeling good, what do? Do you always do it till the end, this do-it-yourself thing? No. Similarly, your teeth, your jawbone are all a part of your body. And it is always better to take a professional advice, to take a professional treatment for any problems that you have. And please do not follow any DIY stuff. Now you can mainly see that there are things like rubber bands which are being applied, like the rubber bows which are applied to the hair usually, ones which we use to stack or fold the papers. That rubber bands are used to attach to your teeth and then close the gap. Or if you are having teeth which are in front, then they advise you to put some sellotapes so that the front teeth would just go back. Or they tell you to change the position of your tongue or change some habits, keep a pencil in your mouth, etc, etc, etc. Or I have seen recently a case where the patient herself, by seeing all the videos, put up the braces, and then she landed up into something which was more troublesome and difficult to treat, and it was very much time consuming also and financially also a burden. So friends, now tell me that have you tried any of this? If yes, I would say that please don't do it. It is the time that you run and rush to your dentist, because what really happens, why am I telling you not to do this? See, we or an orthodontist is a learned professional. They have invested their 5, 8 and some have invested their 10 years acquiring and mastering this degree. So if someone has put in so much efforts, obviously they have the technical knowledge of what is exactly being happening or what is exactly being done in this particular treatment. What treatment is required for what patient, that knowledge they have. Now, so the technical guidance is somewhere missing when you do it yourself. The second thing is that you don't really know how much pressure is to be applied on what tooth. So if you are applying 2 rubber bands and you want it faster, you are applying 4 rubber bands. Like the case I discussed, she applied the braces on her own by buying all the material from the market. You cannot build a house just by getting bricks and cement. You need an architect, an interior and engineer to do that work for you, right? So, similar way, just buying some material from the market and placing the braces on your mouth is not going to work, because the professionals know what direction should the braces be applied, how much force should be applied, what wire should be used, what gauge wire should be used, how much diameter, how much pressure, how much force, because we are dealing with something which is the hardest thing in the body, and this hardest thing has to be moved. They have to be got into that correct position. So do you really think the simple rubber band or a tape on your face can treat it properly? How much pressure are you applying? You don't know. And also, the third thing is that the chances of relapse are much more higher when you do it yourself. Now, what is exactly relapse? Relapse is the teeth have, by some chance or luck, they have shifted. The gap, the midline diastema has closed down by the help of rubber bands or with the help of sellotapes or change of some habits. And now what? There is no retention given. There is no proper guidance given. You don't know how much time should you keep the rubber band. As the orthodontist always knows that yes, this is the time the braces should be kept there so that the teeth becomes stabilized in their new position. Then they give retention. You don't know that, and hence as soon as the change is seen, you go back to your normal routine life and you see that there is a great amount of relapse, that is the teeth start moving back to their original position how they were before. So friends, with all these things, remember that you are not going to do good, but you are going to do more harm to your body by this trial and experiments. Yes, I am going to call this as trial and experiments because it is done by you. When a professional does it, it is called as treatment because they know what they are doing, they know what results are achievable. So before trying anything at home, I would suggest just once visit your dentist. If you have certain issues, talk to your family members, to your friends, to your dentist. There are different ways you can sort these things out. In all the ways I'm saying. Time consuming, financially, or not supportive family. Anything. So if there is anything that you need to talk about, here in the comment section also you can comment. I am and my team is always there to help you out. Also feel free to visit a nearby dentist and take one small consultation because that is going to be of great help. Friends, these DIY things at home are less effective and more dangerous. So before opting for it, think twice. Till then, keep watching my videos. Do not forget to like. If you are liking my videos, share it with your friends because even they should be updated about the dental facts. And feel free to comment if you have anything to say about the video or have any questions related to braces and in general dental health. Do not forget to subscribe to my channel Dr. Mansi Shah and press the bell icon so that every time I post a video, you will be notified about it. Till then, stay healthy, stay happy and stay over fit. Thank you.